recording.
Oh, you didn't record it.
Oh, now it's
recording.
recording.
Start over. Okay.
Okay.
Now it's recording.
Oracles.
All right, you got your oracles,
Okay.
and then that leads into your atrium.
Right.
This atrium, since it's your right atrium, has the coronary sinus,
Right.
which is this red dot.
Such an SA node and AV node.
Right, which are for the electrical
SA node.
impulse.
We will.
We
In a
will in
second.
just a minute, but
Okay, once you're done.
yeah,
Yeah.
definitely.
Lecture series.
And then, so this is where the your coronary vein dumps in. So the veins of your heart dump the blood back into the right atrium.
Okay.
They don't actually connect into either the vena cava, superior vena cava, inferior vena cava. Your fossa ovalis,
It's closed.
it's closed, right? In a baby, it's open, foramen ovale.
Right.
It's where
Then this is your
the crystal
AV valve
Okay.
right here.
connects. I think that's what it is.
And then this is your papillary muscle.
I'm pretty sure.
Okay.
This little thing sticking up connects right here to your capillary terminal.
Yeah, but this is
Chordae tendineae, sorry. Chordae tendineae, which are these little thingies. And then this is your interventricular septum, because it separates the two sides.
Okay.
And the red here is your myocardium. The pink is your endocardium. And this is your epicardium on the outside.
Okay.
And then, let's see where else. Then you go out through the semilunar valve.
Okay. That's part of.
This comes from your right ventricle.
anybody using that panel right there?
We are in just a minute.
Oh, okay.
So your right ventricle goes through the semilunar valve to your pulmonary artery,
Away from the heart.
away from the heart. Right, comes out, goes out, comes all the way back in, and dumps itself through the pulmonary veins, which are red.
Okay. So it comes in through the veins.
Comes in back in through the vein,
Okay.
pulmonary veins,
Oxygenated.
In the left atrium.
into the left atria.
So does it go into your lungs and then back in? Or?
Yes,
Out to the
plus
lungs,
oxygen.
exactly.
After the
Yep.
lungs,
Oxygen
it
rich.
gets oxygen and then comes back into the vein.
Exactly.
Pulmonary vein.
The
to your
pulmonary
left
vein.
atrium,
Right,
to your AV valves.
right. Goes through the AV valve.
To your left ventricle.
Down
Which is
to
the
the-
strongest muscle.
Yep, this is your strongest. That's why it's all big and
Goes
fat
out.
like that. This is your apex of your heart, and then it goes out the semilunar valve here, which goes up the ascending aorta
Aorta.
to your
BCS.
basocephalic, then your common carotid, then your subclavian. This is your aortic arch, and this is your descending aorta. Right
So
here.
the blood just rushes through all four of those.
Yep, because once it pumps out of here, it goes everywhere in the
Right.
entire body.
Okay. And then from there.
And then from there, that's when
Goes to
you
your
go
body.
Right, that's when you go to that model, because that shows you where all those arteries and stuff go.
Okay.
You might want to start over because it might be a big file to send.